Hello everyone. Today I would like to talk about cosmetic rejuvenation of the face. Essentially, what cosmetic procedures can we be doing to help us achieve a more youthful appearance? Before talking about the cosmetic procedures that I consider to be or that I consider to have a high success rate, I would like to talk about the different changes that the face undergoes as we mature. One of the changes is highly related to sun exposure, and that's essentially pigmentary and textural changes of the skin. And the most common ones are sunspots and melasma, which are the brown patches that you see on the cheeks and the forehead. In addition to that, there are fine lines and wrinkles that we develop over time, and frequently fine lines and wrinkles occur around areas of the face that move, but around the mouth and around the eyes and across the forehead when we raise the eyebrows. But you can see fine lines and wrinkles really throughout the entire face. Those are just the most prominent areas. And last but not least, over time, there's actual volume loss of the face. If you think about how when we are young and when we're children, toddlers, you see them and they have very chubby cheeks. And when you think about somebody that's older, we've lost that chubbiness to our cheeks. We've lost that baby fat that we all used to have. And so these are the types of changes that our faces go through as we mature, and ultimately give us a more mature looking face. Now, not all of those changes are bad. They're not necessarily negative, and everybody's face matures differently. And it's important whenever there's an individual who's interested in cosmetic rejuvenation of the face, it's important to evaluate the face and determine what is the most prominent area, or what area is contributing to the face appearing more mature. And also, what is bothering the patient the most? So if somebody comes in and they say, well, I am mostly bothered by all these brown spots, well, then I'm going to say, okay, let's talk about that. How quickly do you want to get rid of these? I like to take my time to treat patients, because I find that patients do better when we treat consistently over time. So if somebody has time on their hands, I tell them, do a 3-month trial of these creams. And the creams are selected out with like a morning sunscreen, a wash, an evening moisturizer, along with a anti-wrinkle night cream. And that regimen is selected out specifically for the patient, and I want them to try it consistently for 3 months, knowing that if after 3 months they're not looking better, we're gonna kick it up a notch. But if they tell me, no, I've already tried that, or I've bought creams before and I'm just not the kind of person that's going to be consistent with them, or I just simply I'm eager and I want to get started, well, then I say, okay, well, let's see how much we can accomplish with, say, chemical peels or with laser. And we talk about, what a treatment plan with one or the other would look like. And some individuals choose one, or they choose the other, or they choose a combination of them. But ultimately, we come up with a plan to treat the area of concern or the area that's most affecting them. Now, if an individual tells me, oh, well, I am bothered the most by these lines around my eyes, or if they tell me I'm bothered by these lines across my forehead, well, then I may say, you know what, those are areas that typically respond really well to Botox. And bottom line is that if I have an area that I know responds well to Botox, it's highly likely that I'm going to recommend Botox, because Botox has a very high success rate and the complication rate is really low. In other words, patients tend to do well with Botox, and they tend to be happy with Botox. Now, the thing about Botox is that it's temporary. So the good thing is that it's temporary. So if you happen to be one of the very few patients that has a complication, it's just temporary. It's going to go away over time. You just have to write it out. But the bad thing about Botox is that it's just temporary, because chances are that you're going to like the way Botox, if Botox is injected appropriately, chances are you're going to like Botox effects on your face. And if you like those effects, you're going to want them to last the entire year. And the truth is that Botox is only temporary, and you're going to need to be re-injected. So if an individual happens to have fine lines and or wrinkles in an area that's amenable to Botox, I'm going to say let's inject Botox. If it's not, then I'm going to say, okay, well, is this an area that I could potentially fill with a filler? Or is this an area that could potentially diminish the fine lines and wrinkles if we use a chemical peel? If we use laser, could we possibly diminish the prominence of the prominent lines or wrinkles? So those are all, or even microneedling. Those are all types of procedures that we could use alone or in combination, and frequently the best results are reached when we use them in combination to help rejuvenate the face. Last but not least is volume loss. And if an individual points out some sort of change on their face that is related to volume loss, I'm going to go straight to fillers. And I'm going to say, okay, well, let's talk about fillers. Now, I really, really like hyaluronic acid fillers. There's many other fillers out there. The ones that I inject are hyaluronic acid because I like them. I like the results on the face. I think that patients look good with them. The complication rate is really low, and patients generally tolerate it really well, and most patients are satisfied with the results. So I like hyaluronic acid fillers. That's what I use. I am particularly partial to the Juvederm family of fillers because I have a lot of experience with those, and I've injected a number of patients, and I've had patients that are happy with those results. Depending on what part of the face they point out that is bothering them, we can focus in on that area. So if they tell me that they're bothered by the marionette lines, well, I use one filler. Or if they don't like their parentheses, well, I use another filler. If they tell me that they don't like the lines around their lips, or if they've lost their upper lip, many times we lose our lip. Our lip thins out as we get older. They want a fuller lip. Or if they feel like their eyes are becoming a little bit gaunt and they're getting lines right underneath here, well, then I use a different filler. In addition to that, you should know that now there are fillers out there that we can use right along this area to augment the mid-face, and those fillers fill and they volume, and they fill with volume, and they pull the face up so that they help even the lower face, and they help the jowls. They pull everything up. So you can imagine that the best results for any one individual are usually achieved with a combination of different treatments, whether that's a little bit of Botox, a little bit of fillers, a little bit of chemical peels, a good cream regimen, plus minus laser. You know, everybody is different. Everybody has their own their face matures in its own way. And to be quite honest, as a person, I like to see certain changes that a face undergoes as it matures. I don't necessarily see everything as those changes as negative, and I think a lot of people are like that. And so I think it's important to focus in on what the patient likes and does not like about their face, and try to focus in on the changes that the face has had over time, and focus in on those changes that truly can be improved with the cosmetic procedures that we currently have available to us. It's important for people out there to know that board certified dermatologists are trained to be able to evaluate the face from the cosmetic, from a cosmetically, so that we can approach rejuvenation of the face in a very systematic manner. Board certified dermatologists have that training. So I highly recommend that if you are an individual that is considering, if you are considering getting a cosmetic procedure, I highly recommend that you see a board certified dermatologist. To that end, I offer 4 beauty events, one every season throughout the course of the year here in my clinic in San Antonio. And those beauty events usually last about 2 to 3 hours. And during that time frame, we offer free cosmetic evaluations where I determine the treatment plan that I would recommend, the cosmetic treatment plan that I would recommend for the individual. And I see patients the entire time that I'm there. And every treatment plan that we form is very customized to that person. So if you happen to be someone who's considering getting a cosmetic procedure, make your appointment with a board certified dermatologist. From the Alamo City, this is Dr. Ana Sauceda, helping you put your best face forward. Take care.